I rise this afternoon here on the Senate floor to mark what will soon be the passage, in just a matter of moments, of a vital veterans bill, and to thank my colleagues on both Republican and Democrats who came together to support the Health Care for Burn Pit Veterans Act. This is an important bill, and it will remove hurdles for post-9/11 Iraq and Afghanistan veterans in particular who were exposed to burn pits so they can receive health care from the VA without delay. This legislation is co-sponsored by every single member of the Senate VA committee, and I commend each of my Senate colleagues in their support for this legislation. Supporting our veterans has a way of bringing us together, and I'm so glad that's true. I'm on the floor this afternoon with the chairman of the Senate Committee on Veterans Affairs, and I appreciate how he and my Senate colleagues understand the urgency of this bill and are quickly moving to pass it by unanimous consent. Post-9/11 veterans are the newest generation of American heroes to suffer from toxic exposure encountered during military service, and passing this legislation marks just a first step of a phased approach to solving the complex challenges of caring for those veterans exposed to burn pits and other toxic exposures. For way too long, we have heard from veterans who got sick after exposure to burn pits and need life-saving care. There's a bipartisan consensus on our committee that this phased approach, delivering health care now and reforming the benefits system next, is the most effective pathway forward for toxic exposure veterans and all other veterans as well. Service members are willing to make the ultimate sacrifice for their country. We know that, we respect that, we honor that. We must match that level of commitment by crafting thoughtful and effective solutions to make certain we hold up our end of the bargain and continuously work toward the best outcomes for those who served and sacrificed. I once joined a roundtable in Wichita, Kansas, with local members of the Vietnam Veterans of America and was moved by their stories, not only their own health consequences of Agent Orange, but their concerns of how their exposure was affecting the health of their children and grandchildren. From that veteran feedback, I introduced the Toxic Exposure Research Act with Senator Blumenthal, which was signed into law in 2016. And I've since heard from many veterans in Kansas and across the country who are sick and dying from the effects of toxic exposure caused by burn pits. Addressing the needs of veterans exposed to burn pits cannot wait. This legislation can be life-saving for those exposed or suffering. When our men and women in uniform go into harm's way on our behalf, we owe it to them to take care of them when they come home for whatever injuries are incurred during their service. This is not a question of resources. This is a question of getting reform done in the right way. The Senate has now, or soon will, act to pass this bill, moving us closer to completing Phase 1 of this approach to provide timely, sustainable care to our veterans. I'll continue to work with veterans advocates in the VA and, importantly, my colleagues on the Senate Committee on Veterans Affairs and its chairman, Senator Tester of Montana, to make sure we are crafting legislative solutions that are veteran-centric. I call upon my colleagues in the House to quickly take action and pass this bill and to act on our promise as a nation so that post-9/11 veterans who are suffering from toxic exposures can get the care they need. I thank my colleagues on the committee, Chairman Tester, and our respective staffs for working to craft this feasible path forward. I also want to thank many veteran organizations who have expressed their support for this legislation, including the Disabled Veterans of America, the Veterans of Foreign Wars, the Wounded Warrior Project, the Iraq and Afghanistan Veterans of America, the American Legion, Military Officers Association of America, and Military Veterans Advocacy. I'm confident that if we continue to work together with the VA and with veteran groups, we will keep the needs of veterans foremost in our minds, that we can deliver meaningful reforms for the current generation of veterans and for all those who come thereafter. Mr. President, I yield the floor to the senator from Montana.
Mr. President,
Anna?
I want to thank my friend, the senator from Kansas, Senator Moran, the ranking member of the Veterans Affairs Committee. When we started this Congress, the number one issue that was put forth by the veteran service organizations representing the veterans of this country was toxic exposure. It was incumbent that the Veterans Affairs Committee do something about toxic exposure, and we created a bill called the Cost of War Act. We're at a point now where we're going to try to implement that bill in phases. The phase we're working on today has 6 major components to it. Number 1, it expands the period of health care eligibility for combat veterans who served after September 11th, 2001 from 5 years to 10. Number 2, it provides an open enrollment period for any post-9/11 combat veteran who is more than 10 years from separation. Number 3, after we do the first 2 things, it tells the VA to have an outreach plan to contact veterans who did not enroll during their initial period of enhanced eligibility so that they can sign up for the potential benefits. It directs the VA to incorporate a clinical screening regarding a veteran's potential exposures and symptoms commonly associated with toxic substances. The 5th thing it does is it mandates toxic exposure-related education and training for healthcare and benefits personnel that work at the VA. And finally, it strengthens federal research on toxic exposure. This is a big bill. It's an important bill. And it does right by our veterans in this country. Toxic exposure is not something that's new. We've dealt with it since World War I, World War II, Agent Orange in the Vietnam War, and now toxic exposure due to burn pits. When we get done with this process, it's not going to take an act of Congress to get the benefits they need when it comes to toxic exposure moving into the future. This is a giant step forward in that regard. And so I want to thank both the minority and majority staffs, the senator from Kansas, who has been an incredible help being able to work together to get this to the point it is today. So as if in legislative session, Mr. President, I ask unanimous consent that the President proceed to the immediate consideration of calendar number 263, S3541.
The clerk will report.
Calendar number 263, S3541, a bill to improve health care and services for veterans exposed to toxic substances and for other purposes.
Without objection, the Senate will proceed.
Mr. President, I would ask unanimous consent that the bill be considered read a 3rd time.
Is there objection? Without objection.
I know of no further debate on the bill.
Is there further debate?
Hearing none.
Hearing none.
The question is on passage of the bill.
The question is on passage of the bill.
All those in favor say aye.
All those in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes do have it. The bill is passed.
Mr. President, I'd ask unanimous consent that the motion to reconsider be considered, made, and laid upon the table.
Without objection.
Thank you, Mr. President. I yield the floor.